Everybody, thank you so much for being here. I'll start by saying I have no financial disclosures that need to be made today, although I am in the process of writing a textbook chapter, so I do have some association with Cambridge University Press, and I'm also in peer review for a paper with academic psychiatry, so I do have those affiliations. No financial disclosures, however, related to those. In terms of who I am, I'm the Chief Fellow at the University of Hawaii's Child and Adolescent Psychiatry Fellowship. I'm part of an 8-person group through the American Psychiatric Association that's trying to tackle how mental health can help in terms of dealing with the climate crisis and how we can understand and address the mental health implications of this crisis. I also work with the Climate Psychiatry Alliance, and I caucus with the American Psychiatric Association's Climate Change and Mental Health Caucus. So when we think about mental health, what does climate change have to do with it? And I'll say for this talk, we're going to have a lens looking through primarily the Pacific Islander perspective, although of course, some of our best data comes from the United States mainland, so we'll bring some of that in as well as we talk. I'm going to start by discussing some of the components of climate change, then we'll lay out the causes and some of the existing evidence. And I just want to mention in advance, we will get to the mental health side, but I do want to quickly start with where we are right now. So we're going to start with outlining some crucial milestones and projections for the Earth's climate. We're going to look at how indirectly, stuff like natural disasters and changes in temperature are going to have real impacts on things like trauma, depression, suicidality, anxiety, and substance use. And then I think you should learn throughout our talk how you can discuss climate-related mental health impacts with your patients and maybe some stuff we can do about it. Climate change includes both the global warming driven by our emission of greenhouse gas and the resulting large-scale shifts in weather patterns. Human activity has caused climate change, and that fact is not disputed by any scientific body of national or international standing. The following is a non-exhaustive list of internationally recognized scientific organizations who affirm that climate change is a result of human activities. Standouts include NASA, the Micronesia Climate Change Alliance, U.S. National Academy of Sciences, the American Medical Association, the American and World Psychiatric Associations, and more. The largest driver has been the emission of greenhouse gases, and we've heard a lot about, of which more than 90% are carbon dioxide and methane. Fossil fuel burning for energy consumption is our main source of this, but we also have significant contributions from agriculture, industrial processes, and deforestation. Let's quickly talk about the greenhouse gas effect. Temperature rise is accelerated or tempered by climate feedback. So things like the loss of sunlight reflecting snow and ice, or increased water vapor, which is itself a little talked about greenhouse gas. And also changes to the land and ocean carbon sinks. Like the glass in a greenhouse trapping heat, we can see an increase in temperatures on average across the globe. Land heats faster than oceans.
You have a couple of comments, actually.
Sure, absolutely.
Right. So Christina Carter said she feels concern and a sense of urgency to take action. And Randy says, climates run in cycles. None of us are old enough to have experienced the previous cycle, which is true. Judy says, soon the plants and animals will be extinct, which will affect everyone too. And Joseph Cohn again says, the primary cause is industrial animal agriculture. So you can comment on all that.
Yeah, so I definitely want to get to the Earth's climate experiences changes. We'll definitely circle back to that. And we'll look at the scale and the speed of the changes we've experienced, kind of in the context of the larger epoch changes of Earth's climate. Definitely, the way we interact with food, the way we interact with our environment has a tremendous effect on this, of which agro business is a huge factor as well. And thanks for the other comments. So I just want to look at this map here. This map shows where on Earth the temperature has changed in the last 50 years. We're comparing to like our 1950s, 1970s baseline here, and we can see that the temperature change has happened unevenly. Water has really high specific temperature, its ability to store and absorb heat, which means the ocean has actually absorbed 90% of the extra heat from global warming. What this means is over the past 150 years of industrial revolution, the oceans have absorbed one Hiroshima-class nuclear bomb's worth of excess energy every second. Increasing atmospheric energy and rates of evaporation cause more intense storms and weather extremes, and this is what damages our infrastructure, our agriculture, and our communities. These extremes are part of a larger pattern, destabilization of local and global weather patterns. We'll cover this more shortly, but will suffice to say for now that the frequency and intensity of extreme weather is unprecedented in what humans would call history. Earth has had many changes before, so surely some will say, what we're experiencing now, it's nothing new. Human civilization, the part where we've written stuff down, has benefited tremendously from a 10,000-year period of warm, wet, and climatically stable weather, which we call the Holocene. But increasingly, human contributions to the atmosphere and our planet have changed. It's changed our planet, and we are now no longer in the Holocene. We are now in a human-powered era, the Anthropocene, where our own contributions to nature define the state of the planet. I want to show here this chart. This chart shows the global temperature in the Common Era. So the times that we most think about and have most relevance to us as humans from the last 2,000 years, starting in year 0 and going a few years past 2000 here. What we can see is since the 1880s, there's been a fundamental shift in the range of possible temperatures. The average global temperature started increasing after the Industrial Revolution and has continued its meteoric rise ever since. Put another way, and to say nothing of forecasts, the current spike in temperature is beyond alarming and relates to our own actions. Another visualization of temperature here. I really want to talk about the idea that Earth's planet, the Earth's environment changes, and that this is something that's happened before. A lot of people think about Ice Age Earth when we talk about this. 20,000 years ago, we were under a half mile of ice, and that's a tremendously different planet. In the course of changing from Ice Age Earth to now, what we saw was a 4.5 Celsius degree temperature change, right? So in that 4.5 temperature degrees change, we saw 1.5 miles worth of ice melted. Current forecasts from the International Panel on Climate Change, based on our modern rates of pollution, place us just 80 years away from recreating this exact temperature change, a surge of temperature previously strong enough to melt a half-mile thick sheet of ice. This change, which previously occurred over 800 human generations, is now set to occur in 80 years. Global warming and climate change are associated with increased risk for global emergencies of nearly any kind. Since the 1980s, research has been published linking disasters to mental health consequences. And emergencies influences on mental health could happen before, during, or after a disaster. The frequency of highly damaging events, what we call these billion-dollar weather disasters, has been increasing. 2021 season hosted a staggering 20 separate billion-dollar weather disasters, the highest ever experienced by the United States, except for 2020, which had even more. Climate change is going to increase extreme heat events like heat waves and droughts because we're going to have changes in our ground humidity and higher levels of evaporation. But we're also going to see rising ocean surface temperatures and anomalies in humidity. It's going to cause changes in our water and increase risk for things like flooding, hurricanes, and coastal storms. We also expect to see a rise in severe CAPE, or convective available potential energy thunderstorms. This is basically just the nastiest category of thunderstorms and other weather events like tornadoes and supercells. There's also an increase in wildfires as climate change happens, but we also see kind of paradoxically an increase in extreme weather storms and snowfall, which can at times feel kind of confusing. It's important to remember, though, that what's changing isn't just temperature, it's entropy. Changes in jet streams and global weather systems bring foreign weather into unique areas. And that's really a change outside of just our concept of temperature. And I know what you're all thinking, we're 5 minutes in, we haven't talked about psychiatry here. I promise we're going to talk about behavioral health now and for the rest of our slides. But the controversial...
We do have a temperature question.
Of course.
Fahrenheit or Celsius?
For which?
The temperatures that you were describing.
So it's the 4.5 degrees Celsius temperature change was the temperature required to melt the half-mile thick sheet of ice.
Thank you.
Of course. Yeah, so promise now, we'll focus more on the mental health side of things, on the provider side of things, but the controversial nature of climate science today and the prevalence of disinformation, intentional and unintentional, really means we need to talk about that before we can get into the gray matter. So the World Health Organization forecasts 250,000 additional deaths starting in 2030 as a result of climate change, mostly from stuff like heat stress and disease, undernutrition. And then we see direct healthcare costs estimated at $2 to $4 trillion a year by the nearby 2030. Already, for every year since 2008, an average of more than 20 million people are forced to move because of weather-related events. This is according to the United Nations. And for the first time, the World Economic Forum's long-term risk outlook is dominated by climate change in its many forms. I'll give you a second here. Look, the events in green representing general Earth biology changes. At this moment, up to 80% of the global population is affected by some degree of water.
Dr. Lee, for some reason it just started echoing. Do you have another instrument on or anything? It was just like on this slide. I don't know why.
So let me know if it continues. Perhaps somebody is unmuted.
Yeah, we still hear it. I'm trying to see it. It looks like everyone is muted.
Yeah, that's really interesting that it just started. Maybe, oh no, we can't hear you now. So you only have one. So some folks aren't muted. Please mute yourself if you're not muted. Let's check.
Any better?
I think so.
I think that's better.
Just let me know. The World Wildlife Foundation forecasts that by 2025, 2/3 of the world's population may face water shortages. And according to the UN and the World Wildlife Fund, 1.1 billion lack access to water. And 2.7 billion find water scarce for at least 1 month of the year already. Many of the water systems humans depend on for basic survival have been stressed and are increasingly drying up or becoming polluted as a result of human activity. Unfortunately, this is a crisis which is getting worse, not better. I'll let the World Health Organization Director General put it plainly. The evidence is overwhelming. Climate change endangers human health, solutions exist, and we need to act decisively to change this trajectory. Put another way, climate change is the greatest threat to global health in the 21st century. And what of some of our own organization, the American Psychiatric Association? The APA recognizes that climate change poses a threat to public health, including mental health, and that those with mental health disorders are disproportionately impacted by the consequences of climate change. The APA did a really good poll, and they found that 63% of Americans believe climate change is impacting our health, and almost half believe that it has already impacted our mental health. So let's talk about hurricanes. Studies following Hurricanes Rita and Katrina found heightened cigarette and alcohol use amongst teen and adult survivors. It also saw that rates of domestic violence and intimate partner violence following displacement in the results of these disasters exploded to 3 times national rates. We saw similar findings in Hurricanes Andrew in America, Hurricane Mitch in Nicaragua, and the 2000 cyclone in Bangladesh. Just take a moment to consider how traumatic it would be to live through a disaster like this. How do you imagine that would change things like mental or your likelihood of thinking about or attempting suicide? What we see is after Katrina, looking at about 800 survivors, we found that the rate of suicidal ideation increased from 3 to 6.5%, and suicidal planning increased 2.5-fold. We also saw real changes in the rates of serious mental illness. If you think the impact falls only on our patients, I'll reference this 2013 study looking at the mental health consequences of the 2004 Florida hurricane season. And this is looking at healthcare workers. This is us. The 2004 Florida hurricane season was unprecedented in its brutality. Within 7 weeks, 4 hurricanes and 1 tropical storm made landfall in Florida, causing almost $5 billion in damages. The state and local public health workers stepped up and were the ones most directly involved in the response to this disaster. But the workers faced a heavy consequence. The workers were found to experience higher rates of probable depression and probable PTSD, and the workers with the highest exposure to the hurricanes were 3.5 times more likely to report increased tobacco use, 3 times more likely to report increased alcohol use. Of note, when you look at things like the probable PTSD and the probable depression, it wasn't just increases in workload. If you controlled for the amount of workload, these numbers didn't go up. What went up was that they were exposed more directly to these disasters. Of course, tropical storms aren't just something that happens other places. You may remember in 2015, Typhoon Newell, which struck Yap and other states, 30 centimeters, like a foot of rain, and gusting at 200 kilometers an hour, so like 125 miles per hour. That same year, Typhoon Masik became the most powerful pre-April tropical cyclone on record in the Northwest Pacific Ocean. It was a Category 5 storm, a super typhoon, which ended up striking Chuuk, Feist, Ulithi, and Yap. This storm had unusual, unseasonal staying power and became the first typhoon to pass over Chuuk Lagoon since Typhoon Amy back in the 70s. Factors including the melting of glaciers and the expansion of seawater as it warms projected to cause an increase in ocean levels between 11 inches and 47 inches by 2100. 11 inches, nearly a foot, that is our best case. Countries with low-lying areas and a majority of islands face significant danger. The island nations of Vanuatu, Tuvalu, Fiji, and Kiribati, the Marshall Islands, the Federated States, in particular, face total obliteration in the short term, despite particularly minor contributions to emissions. Vanuatu, for instance, was responsible for 0.0016% of global emissions in 2018, but I had to expand their slice substantially, 1,000%, so you could see it on a normal screen. Despite this minuscule contribution, they face total obliteration in the short term. Hundreds of island communities, as well as the significantly larger populations in Southeast Asia and other low-lying areas, face significant risks of mass migration and disruption of their ways of life. Have a look around this map. Look at where your family or relatives live. These darkest areas are at significant peril. We know 5 meters of sea level rise would impact hundreds of millions. The National Oceanic and Atmospheric Administration has a really powerful tool. I looked, they really only have data for the United States, so I focused on some visualizations here from Honolulu, where I'm speaking to you now. And I want to show you some of the areas on our island, how they're impacted by projected sea level rise and what that might look like kind of in your own situations. So we see 6 feet of sea level rise would cause basically total destruction of my city, Honolulu. And if you increase that to something like 10 feet of sea level rise, the effect is even greater. We see is that there's a disproportionate impact kind of based on where you go. In some sections, 5, 10 feet of sea level rise isn't that catastrophic. And in other areas, like in the Oahu city of Kailua, it takes you entirely off the map. Kailua would be completely, fundamentally destroyed by this kind of a change. And what this shows is a pattern. Low-lying areas next to the coast have tremendous vulnerability. This is likely a resonant topic for a lot of the people here. A lot of the federated states, including Nalepenlode, have already been lost to sea level rise. We know that the Northwest and the Southwest Pacific Ocean continues to face the greatest global sea level rise in the past few decades, and it's actually risen at 3 times the global average, quite frightening even in a local context. In parts of Micronesia, sea level between 1993 and 2012, rose 3 times the global average. And you can see here that there's been significant changes in the shapes of islands, even within the very recent memory, even within the last 20 years. Reef islands with loose packed gravel and sand are particularly vulnerable to wave erosion, which happens to really expedite their rate of disappearance. And in many places, such as Dawak Island, the erosion leaves behind these skeletonized mangrove trees. And this can be really upsetting for a lot of people to see such visual evidence of these changes. Sea level rise, along with the changes in rainfall patterns and glacier melts, are also associated with increased risk of flooding. Based on 2022's population distribution, a meter of global average sea level rise could expose 150 million people to potential flooding, and you get like 550 million people if you talk about a 5-meter sea level rise. Like other disasters, studies demonstrate associations between flooding and serious trauma. A really good example comes from Mexico in 1999. They had a serious flood there, and a study looking at 550 people found 24% prevalence of PTSD. I mean, really unreal. In the years following the 1990s flood in Hunan province, China, we saw increased symptoms of trauma. In that same year, flooding in Bangladesh brought 75% of the country underwater, including the capital city of Dhaka city. This is an event that displaced 30 million people and brought about a rise in reports of domestic violence. Again, unbelievably disruptive and increasingly common. A 10-year satellite-based analysis shows for the first time that biological productivity of the oceans is tightly linked to climate change and would be reduced by global warming. This satellite data comes directly from NASA and was published in the journal Nature. It details the ebb and flow of microscopic life within our systems. Here, robust plant life is recommended in green, and areas of low productivity are represented in blue. Why does this matter? Well, phytoplankton, which are responsible for most of the transfer of carbon dioxide from the atmosphere to the ocean, will also contribute the entirety of the oxygen for half of every breath humans take. Their role in the carbon, nitrogen, and phosphorus cycle cements their crucial role in stabilizing global food chains. Here we can see a forecast showing blue, which is low, and red, which is high, nitrogen to phosphorus ratios in ocean algae. This crucial ratio will be irreparably disrupted given even a 5 degrees Celsius rise in temperature. Rising temperatures and the changes that bring are harming fish stocks in most parts of the globe. As of 2020, 38 million people worldwide rely on fishing as their primary source of income. That's like California's worth of people. Disruption of the world's oceans is going to place tens of millions of people at risk for loss of work, place entire regions at risk for food scarcity or famine, and threatens the very air we breathe. Deforestation describes the tremendous loss of biomass, largely due to human-directed activity, including farming, land clearing in support of grazing and mining, and mining. 80% of the world's land-based species live in forests, but the area of native tree cover worldwide has decreased by 300,000 square miles since the 1990s. That's an area 50% bigger than France gone in the last 30 years. This is according to the Food and Agricultural Division of the United Nations. Most people agree there has been a loss of countless important locations of world heritage. Why does this matter, and why is this related to mental health? Well, in general, surveys reveal that people who spend time in green spaces like forests survey themselves as feeling happier and more content. For indigenous populations, the results and implications are even more catastrophic, including the loss of ancient historical and community sites. This gets into an idea called solastalgia. Derived from the word nostalgia, solastalgia is the particular type of homesickness one gets when we're still at home, but our home has changed. This is used mostly to describe the negative stress or mental health implications of the chronic destruction of our planet. Someone earlier mentioned extinctions and the mass dying. Truly no softer word for it. And I want to talk about that now. Component to that phrase, Anthropocene, is an understanding that humans have become the prominent, dominant evolutionary force on our Earth.
we drive extinction, unfortunately. There's been 5 other significant points in our history where there's been events of mass dying. This isn't something unique, but to quote the biologist Telmo Piovani, now the asteroid bears our name. Although this represents just a blink of an eye in the geologic timescale, human dominance across the last 12 millennia has produced an estimated extinction of 1 species every 20 minutes. As Martin J. Reeves wrote, we are destroying the book of life before reading it. Growing visibility of these animal extinctions contributes to the phenomena of eco-anxiety, which we'll detail more fully later. Micronesia itself has experienced loss of many bird species, and other species are significantly threatened. We also see that this is not just limited to birds, and even mammal species have become threatened. 5 years ago, a prevailing majority of the world's nations committed to limiting warming to well below 2 degrees Celsius. But in the 5 years since then, we've seen continued temperature rise and documented the 5 hottest years on record. Here again, we see those who contributed the least are impacted the most. And just looking at the last 20 years, we've seen a 50% increase in heat-related deaths. That's not a good trend. What we see is heat stress causes things like mood disorders, anxiety, and other heat-related consequences. While we know that the impacts of heat and rising heat are widespread, we know that they're also disproportionate. Like in the recent European heat wave, we saw more death in women than in men. But we also see this pattern play out in people with mental illness who might have their important mental health medications impacted by high heat, or might have less ability to deal with high heat due to impacts of their thermoregulatory abilities from mental health medicines. During pregnancy, especially in the 2nd and 3rd trimesters, we see that exposure to heat wave reduces birth weights. So we can imagine how that might impact our patients going forward. We're able to do some natural controls for this. In hot temperatures, we see an increase in discomfort, leads to feelings of hostility and aggressive thoughts, possibly actions. You've all had a hot day outside, and you know you can feel far more stressed, but you're not alone in this. These feelings are common. What I mean by we have some good studies for this, I mean, hotter cities are on average more violent than cooler cities, but you can't make a comparison like that. There's differences of culture, there's differences of latitude and longitude, but what I find to be the most convincing is that within an individual city, we see increases in violent behavior in the hottest months. Increases in heat across our planet and increased heat waves are expected to exacerbate these trends. I talked about mental health medicines and their impacts in relation to heat. It's likely that mental health drugs are among the most likely contributors to heat-related morbidity and mortality. In a classic European study looking at heat emissions, anticholinergic drugs, antipsychotics, and anticholinergics were found to be more common among the hospitalized than any other type of mental health medication. Not causative, but that's a correlation of concern. You don't need to remember all of this list, but I think it's important to kind of just discuss many of these mental health medicines are going to have impacts on how our bodies handle heat and are going to be impacted by heat. For example, SSRIs, SNRIs, some of our most common anti-anxiety and antidepressant drugs, can cause or impair sweating and sometimes cause fever. Tricyclic antidepressants cause changes to our cardiac output, changes to our blood pressure, and you can also look at stuff like our stimulants, right? We know that those are going to be involved in both supporting the vasodilatory response during heat and vasoconstriction in the cold. Several other classes are shown here for reference, but there's many ways in which our mental health medicines interact with heat, worsen heat outcomes, and place our patients at disproportionate risk in this growing phenomena of our hot planet. I wanted to talk about infectious disease pandemics. In terms of the relationship between infectious disease and climate, I'll turn to America's own Dr. Anthony Fauci, who wrote for the journal Cell in 2020. Disease emergence reflects dynamic balances and imbalances within complex, globally distributed ecosystems comprising humans, animals, pathogens, and the environments. Understanding these variables is a necessary step in controlling future devastating disease emergencies. One example of this is seen in the changes to the habitats which can support insects. Mosquitoes are, of course, responsible for a number of human diseases like malaria, Zika, dengue fever, and the West Nile virus, all of which are expected to spread into regions in which they're not currently endemic. I'll point out that the risk for malaria transmission has increased 2.5 times compared to the 1950s baseline. And also, I want you to take a look at the right there, that tick. Tick-borne illnesses like Lyme disease are also expected to spread into areas in which they're not currently endemic. And that's particularly concerning for mental health professionals because we know that Lyme disease carries mental health risks. We know that things like hallucinations, paranoia, and catatonia, even mania, are increasingly found in patients who have Lyme disease. Put another way, we have entered a pandemic era. What's the context for this, right? We know that 2.4 billion people lack basic sanitation, which means that other pandemic-capable pathogens like cholera and typhoid can share and be spread more easily, even without changes to their endemic regions. While sanitation technologies continue to improve, it is not a given that access to sanitation will continue to spread. None in this virtual room should need reminding of the tremendous burden our current pandemic has had on psychiatric conditions like anxiety and trauma-related conditions. Some of the best analysis of this comes from The Lancet, which in 2020 emphasized the relationship between worsening environmental degradation, deforestation, and land use changes in causing the current COVID-19 pandemic. Put another way, from the CEO of the American Psychiatric Association, we are also in a mental health pandemic. During COVID, the United States Census Bureau administered a really high-quality study. It looked at 330,000 Americans with this really common PHQ-2 screening, and it found 3 times increase in positive screenings for depressive or anxiety disorders compared to 2019. A study of almost 4,000, a separate study looking at about 4,000 people who had COVID-19, found that more than half reported depressive symptoms months later. Preliminary studies are increasingly finding that the so-called COVID long hauler syndrome is associated with symptoms of of depression and other mental illness. The stuff that we all kind of know intuitively, in addition to the directly negative health of a pandemic, we've all seen how it can cause loneliness, economic strain, increased substance use, reduced physical activity, and increased interpersonal conflict. When we talk about all these risks, it's really crucial to know. When you think about our patients, it's really crucial to think that these risks fall heavily disproportionately. Black, Indigenous, and people of color are disproportionately likely to live in areas impacted by climate change and face these risks with reduced resources to facilitate like adapting their land or modifying their properties to protect themselves against this kind of change. Loss of career may lead to loss of personal or professional identity and loss of our important support structures. There's also a real loss of like the sense of control over our life. If we lose our trade, if we lose our home, we don't have a sense of psychological safety. The American Psychological Association associates these factors with increased risks for feelings of hopelessness, fear, and fatalism. And we know children are most impacted by disasters, and they're the most likely to develop PTSD following a disaster. There's a lot that goes into this, right? They're going to be taken away from their caregivers. They're going to have their routine disrupted. Any stress that befalls their permanent or temporary caregivers is going to trickle down to them, and that causes real problems. We also know that people with mental illness are disproportionately impacted. I want to quickly talk about the words we use to describe these phenomena. The more we discuss climate change with young people, the more we come to understand their growing worries about this issue. I know worry was something that was brought up a lot in our introductory, in our icebreaker, right? While some are going to report grief, despair, guilt, shame, powerlessness, and all these other negative emotions, anxiety is one of the most common worldwide. The so-called climate-related anxiety describes this feeling. There's a concern about the future of our planet, and it's causing worry in a lot of people. A lot of times we mistakenly confer the growing anxiety and anxiety disorders related to climate here. We know that anxiety can be a healthy, normal response. It's a response that tells us something here isn't right. We need to make a change. But increasingly, we can also see anxiety disorders where our anxiety is so problematic, it really makes it more difficult to live our life. Talking about timescale here. In an acute sense, extreme events cause extreme trauma, especially to the underdefended and helpless. Subacute impacts are going to appear for individuals who indirectly witness climate change, experience anxiety related to the uncertain long-term future of humans, especially in a situation where there's political gridlock or inactivation amongst leaders. That can really make people feel extra bad. And then chronic anxieties. These are things like large-scale social and community disruption, people who are forced to move across borders, displacement, violences, struggle for resources, these kind of things. Popular media like television, movies, books, and social media now are inundated with stories of the looming climate crisis. So much so that in 2019, Grist magazine called climate anxiety the biggest pop culture trend of 2019. Going back to the analysis by The Lancet, found that from 2018 to 2019, the coverage of health and climate change in the media has risen almost 100% around the world. Fears ranging from loss of beloved environments, mass deaths of familiar animal species, and increasingly frequent disasters are now widespread. And it's crucial to understand and recognize the mental health implications of climate change have now spread beyond just the patients impacted by disasters and now are really affecting anybody within reach of communications technology. Think about how many of your patients are on social media or watch TV or movies or read books or the newspaper. It's basically everybody. So that's all kind of depressing. I think it's fair to say it's kind of disappointing, kind of a downer. Sorry to bring this to your lunch. But what do we do about it, right? As mental health professionals, what is our role in helping with this? The solutions, to the extent that they exist, combine professional advocacy and personal lifestyle change. So let's talk about that. In terms of our personal lifestyle change, this is the usual advice, right? Reduce your use of single-use packaging, have fewer children, reduce meat in your diet, shop local, recycle. We can also work to understand, calculate, and reduce our carbon footprint, which is a really good data-driven approach. The average American is responsible for 16.5 tons of carbon dioxide a year, the equivalent of 3 elephants' worth. The miles we travel by car, train, bus, and plane, the energy we use in our home, our shopping habits, all this stuff adds up, and it can have significant implications for our total carbon pollution. Purchasing carbon offsets is one crucial way you can support natural or human-led projects to sequester carbon dioxide from the atmosphere. All sorts of projects, restoring grasslands, bird sanctuaries, old growth rainforest, all of these kind of things. I'll just mention here websites offered by not-for-profit organizations like the Cool Effect offer easy-to-navigate marketplaces where you can make carbon offset purchases. But I want to focus more on organizational, institutional, at-work kind of changes because you've all heard this stuff before. We can be sure to educate our patients about protecting themselves from rising temperatures. Here's some quick tips from a pamphlet I designed for Mass Gen Hospital. When it's hot, remind your patients to stay hydrated, stay cool, and stay safe. Teach them the signs of heat exhaustion and let them know that it can progress to heat stroke, a medical emergency. There's a new website made in collaboration between the CDC, NOAA, the EPA, FEMA, OSHA, HHS, the Forest and Park Service, the VA, SAMHSA, everybody's on this, right? This website, heat.gov, provides a great deal of data about the current heat conditions and has all these great webinars, programs, and everything to educate your patients on heat and protecting their families from heat. Along the resources that heat.gov provides, there's a page for healthcare professionals. It prominently includes the Coping with Heat resource page. This is prepared by my frequent collaborator, Dr. Robin Cooper, president of the Climate Psychiatry Alliance. So really great tool that you can use or give to your patients. I talked a little bit about personal lifestyle change, and I sort of quick skimmed that because what really matters is a lot of the bigger institutional stuff here. We'll wrap up here shortly and we can get into some of our discussion, but I think it's really important to remember the healthcare sector pollutes like a lot. If the global healthcare industry were its own country, it would be 7th out of 200 countries in terms of pollution, right? This is a big pollution issue. In the United States, the healthcare sector was responsible, worldwide, the healthcare sector is responsible for 4.6% of global pollution. And if you look at America, it's 8% of our global of our overall greenhouse gas emissions. This is not like a victimless situation. It's not like a number we should get down that doesn't matter. 8% of America's greenhouse gas emissions means that healthcare and the practice of healthcare contributes to over 100,000 disability adjusted life years lost every year from Americans from the practice of healthcare. This chart here is like the whole picture for me. On the left, you can see healthcare access and quality. Who can get healthcare and is it good? And on the bottom, you can see how much pollution we make. America is truly an island here. I mean, the ratio of healthcare access to pollution, it's uniquely terrible. And that leaves us a lot of room to improve, right? We can observe countries in Europe or throughout Asia who have significantly higher healthcare access and quality, but don't have the kind of ridiculous pollution that the United States has. A roadmap for changes, how can we get the United States over to the left? How can we pull our pollution back so we're not literally the worst in the entire planet in this regard? There's a really good roadmap for this, looking at the National Health Service, the largest employer in all of Europe, and the largest single-player healthcare system in the world. While still continuing to provide services for their 50 million people, they formed a Sustainable Development Unit in 2008 to try and meet commitments under the UK's Climate Change Act. Significant reductions in carbon footprint followed, and in January of 2020, the NHS England announced a commitment to become the world's first net zero health system. Similar efforts worldwide have led to increased spending to try and adapt our health systems, including to some extent in the United States. Under the Biden administration, the United States can follow this footprint, but it's going to require professional and individual advocacy. Across the nation, organizations have worked to divest, pulling about $40 billion worth of assets away from fossil fuels, looking just at healthcare organizations. Wrapping up here, it is essential that the solutions to one economic and public health crisis do not exacerbate another. And in the long term, the response to COVID-19 and climate change is most successful when they are closely aligned. Going back to what the American Psychological Association was saying on this, we know that the keys to combating the negative psychological and mental health consequences of this are going to really focus on building resilience in individuals and communities. So one way you can go about this is to try and encourage professionally or through public policy, increased social cohesion, increased social communication. Bringing communities together is a public health response. Analysis of climate change related media shows us that exposure to climate catastrophe promotes anxiety, and the worst stress comes if it's alarmist or discouraging. As scientists, we have a responsibility to promote evidence-based messaging about this crisis and emphasize what actions can still be taken to help our communities. In academia, there's been a 9-fold increase in publication of scientific articles linking health to climate change, and we can be part of telling this story. Organizations such as the Good Grief Network offer community and public health programming to build resilience against catastrophe. You can see here that their process involves processing and working through heavy emotions, deconstructing cultural narratives, and building resilient communities which have the strength to both deal with and grow, if possible, from changes that are happening to the places we live. If you work with younger people, you might use tools like NASA's Climate Kids, obviously a bit of a younger format, working more on educating young people about the impacts of this. And if you work more with like teens or adolescents, the Alliance for Climate Education can be a really good resource for you. In conversation with young people, we want to begin by finding out what they already know, explaining the science in really simple terms, and then you don't need to sugarcoat things, but we can emphasize that there is still hope and that there's things that they can still do to really make a difference. We can work to advocate for clean air regulations and responsible carbon emissions that can work to benefit our patients tremendously. A real shout out to Micronesia here, who has been an international leader in efforts to ban use of hydrofluorocarbons, HFCs, which is the world's fastest growing greenhouse gas. This advocacy should really be celebrated because HFCs are 4,000 times as efficient as warming the planet as the traditional carbon dioxide greenhouse gas. We can also work to advocate additional resources for those who we recognize to be empirically at greatest risk. And if you're kind of new to this, new to advocacy or advocating for your patients in more of a policy arena, there's some really easy to access initiatives on places like social media, Doctors in Politics, or the Sunrise Movement. Those are really going to reduce barriers to entry. And then the US government, for its part, has created the Ready.gov program. It helps assist physicians and their families to prepare disaster resiliency strategies. So just like real quick on this, we're talking with our patients. We want to ask them like, how are you going to receive your emergency alerts? How are you going to receive these warnings? You know, do you have a shelter plan or like an evacuation plan in the case of a tsunami? Do you have a setup for a household or family communication plan? Do you have a go bag or an emergency preparedness kit? And especially in the time of COVID, monkeypox, and whatever other pandemics, epidemics are going on in your area, we're going to make sure we've got things like disinfectants, masks for everyone over the age of 2, things like that. Last mention here, the SAMHSA Disaster Technical Assistance Center, the DTAC, is a really valuable resource to help provide an effective mental health and substance abuse response following disasters. They've got really easy to access resources and support, including a phone number, email, and even a smartphone app. So I talked a ton. I know we've gone a little bit over our initial time here, and I want to get into the discussion of everything. Thank you so much for listening in on this. I think it's a really important topic, and while it is an uncomfortable one, it's unfortunately not going away. I wish I would be the last person to talk with you about climate change and mental health. I'm probably not even the last person to talk with you about climate change and mental health over your lunch. So I really hope that you take this topic seriously and think about the ways that you can look for your patients and be a help, either for patients or communities in adapting to the disasters, the temperature changes, and everything we know to be coming. So thank you all, and we're open to questions, discussions, etc. So thank you so much.
Thank you so much for that. Very depressing talk, but I had not thought how the medications we give can actually affect can interact with the changes in climate such that we have more deaths from from heat stroke, from things like that. And yeah, I really hadn't thought about that. So that actually should be a drug-drug interaction with rather a drug-climate interaction. So one question is, how long do we have? How long do they estimate before Oahu has a 6-foot sea level rise?
So the worst case projection for sea level rise puts 47 inches by 2100. So we aren't going to be seeing a 5-foot or 10-foot sea level rise within the course of our lifetimes. But without substantial changes to the ways in which humans use energy, we know that these are inevitable changes that will continue to happen. The sea level rise is unfortunately rising faster. It's not something that's slowing down right now. So unless we make substantial changes, we do know that these things are processes which will continue. So I'll say 11 inches to 47 inches by 2100 is the best forecast from the IPCC, from the report that came out about 7-8 months ago now. So that's our most clear data we have. And it gets more speculative further out than 2100.
All right. And how does radioactivity figure in?
In which regard?
I'm not actually sure. Oh, probably the sunlight. So let's see. Renata, what do you think? Is it that we're getting more radioactivity because we have less of a barrier from the sun?
She says nuclear.
Nuclear. So
like nuclear energy for fuel? I can just mention one thing on that, which is a little talked about fact is that more radiation happens from the burning of coal and from the life cycle of the use of a coal power plant than exists from a nuclear power plant. So that's kind of a mind-blowing fact that doesn't really seem possible at all. I think we can all visualize that there's less carbon pollution, but actually less environmental radiation and less community level radiation, even with a nuclear power plant compared to a coal-fired power plant. So the significant hope is as we transition away from coal-fired power plants that the level of radiation humans and cities are exposed to should go down, but it's hard to say.
And yet people are now, or countries were heading away from nuclear power plants because of the risk of an event, but the dependence on them is clear if we're going to get away from petroleum. Oh, okay.
There's a phenomena of catastrophe, which I think is really attention grabbing. For instance, coal is a slow killer, which kills tens of thousands of people a year, which causes increased risk of Alzheimer's, which causes cognitive decline and behavioral problems in children through its environmental contaminants. Coal is a huge killer, but it's a slow killer. It's not a headline-grabbing killer. If 3 people die in a nuclear power plant, it's global news. So I think that there's a disproportionality there, and we accept kind of the slow background killers in a way that we aren't willing to accept for obviously a high-intensity nuclear disaster, which is really attention-grabbing.
And then there's the question of nuclear waste. So the water that's used to cool down the nuclear core, where does that go? And is there waste in that water? And how do you purify that water?
Yeah, for sure. Big problems to solve. Absolutely.
And then there's a question about the effects of the full moon on mental stability.
Nothing that I know about that at all. Completely outside of my knowledge base. No idea.
Does anybody want to talk about that? I mean, I know it seems like more crazy things happen when there's a full moon, but I don't know if there's any research on, statistically speaking, if that's true. Okay, so what is one thing people are going to do with this information? I know I'm going to be more likely to consider the impact on sweating and ability to retain fluids in giving medications, especially in seniors when it's hot out, which it's always hot in Hawaii, but hopefully never as hot as some other places. Other folks, what are you gonna do? What does this bring to mind?
And Jacob, I just wanted to thank you again, but and also for your resources. These are resources I had no idea existed. And so we're going to post this for all of our participants in ECHO, and they'll have access to that. And I know for myself, I will be learning more about those resources and how to share them with my patients.
In terms of resources, I have one non-medical resource. I just really strongly want, it doesn't fit within the context of this PowerPoint for today, but the United States Youth Poet Laureate, Amanda Gorman, is a really powerful speaker. She says things that I communicates in ways I only wish I could. She has a brief 4-minute poem about this topic. You can scan the QR code or search it online. Cannot recommend this more strongly. In addition to the heat.gov, the SAMHSA resources, in addition to those tools, I strongly recommend this as a extra content.
Great.
Thank you.
Thank you so much. Next week, we're talking about